stop the stigma. Everyone deserves authentic welcome and a place to belong.
There's nothing completely wrong with you. You're completely fine. You're 100% awesome.
Welcome back to our CBS This Morning special. We're calling it, as you've heard, Stop the Stigma. It's a conversation about mental health. We want to make this a conversation, an ongoing conversation, if you will, to take away the shame and the blame. And that's something Emmy-winning broadcast journalist, and we're proud to say our colleague, Jane Pauley, is very passionate about. After more than 30 years reporting the news, Pauley put a very public face on bipolar disorder. She revealed that she had taken a break from the spotlight and spent 3 weeks in a psychiatric clinic after being diagnosed back in 2001.
And now here's the big picture. An estimated 7 million Americans live with bipolar disorder. It's an illness that can cause dramatic mood swings from depressive lows to manic highs. And Jane is now an advocate for mental health, as well as the host of our beloved CBS Sunday Morning. Jane, thank you for being here.
Jane.
Now, back in 2001, when you were diagnosed, and I should point out that the majority of people who experience mental illness experience it and are diagnosed before the age of 24. In your case, you were
50.
A tad bit older,
Yeah.
50, 3 kids, married.
Successful career.
Very busy career. What was it like to get the diagnosis?
Well, when I was 49, I was not bipolar. When I was 50, I was. I was switched, flipped. These are medical terms of art. Treated for hives, medication that wouldn't have been given to someone, at least without protection and careful observation, if a doctor had reason to think that there was family history or prior history with a mood disorder. I didn't have that.
You had no family history?
None. None that I know of, Gayle. But it unmasked what doctors then described as a genetic vulnerability to a mood disorder, and by that time, I was in pretty deep trouble.
And it's pretty interesting that in terms of experiencing stigma, one of the direct ways that you did is your own doctor who suggested maybe you don't want to tell the public about this whole thing, and he even gave you a little cover story.
I want to talk about stigma a little bit later when you tell me I can, but the only time in my life, and it's been, we're closing in on 20 years, that I experienced stigma was that day one, when I recognized that my doctor was giving me a cover story to tell my employers that I was being treated for a thyroid disorder, which was true, but I knew it was
more than
the whole truth.
Yeah.
And I, poor guy, I said, you know, I'm already writing a book, and the working title is Skywriting: A Life Out of the Blue. This will fit right in. He went pale, but I knew then that with my reputation on television, I'm Midwestern. I am normal.
Because aren't you surprised this happened to you?
Yes, because no, my family had checked other boxes, but not that one.
But how did it manifest itself, though, Jane?
You wrote that the only way to redeem this horrible situation was to talk about it.
That's the way I think. And when I told this my doctor, he kind of turned pale. And I didn't put out a press release. Everybody deserves an opportunity to recover from whatever in private.
Yes. But Jane, I'm really trying to understand exactly how it manifested itself for you. We keep hearing you were diagnosed. So how did it change for you? What was the difference in your life?
Well, I changed. It didn't change for me. It actually got better. The side effect of the steroids for hives was depression, treated with antidepressant.
Were you sad? Were you angry? What was it?
Depression is depression. And then over time, it worked, and I got better and felt much better, and then felt really great, and then started having plans and other behaviors that my husband didn't know who I was. So that when I finally, when the doctor finally recognized, oh, I know what's going on here. This is bad. He called my husband and he said, your wife is very sick. And Gary was almost relieved. Because
to know that there was a diagnosis.
Well, maybe someone can help get my wife back.
You don't like the word stigma. We're calling this program Stop the Stigma.
You think that's the wrong word.
It's a little bit uncomfortable.
Yes, it is my personal advocacy. And I'm not an expert. I'm someone with bipolar. Don't take medical advice from me. But as a communicator, I know something. Words have power.
Yes.
And the word stigma
Is its own stigma.
Is its own stigma.
Yeah.
When you cancer used to have a stigma, and then Betty Ford, and then now we wear pink ribbons and run for the cure. The yellow bracelets. Michael J. Fox fights Parkinson's with hope, with a positive message. So every time you say stigma, it is a reminder of for people like me that I'm fighting two wars.
Yeah.
It's not enough that I have a disorder that's pretty serious.
Yeah.
But I'm also fighting this front. So my goal is that we fight stigma, which is real, but we fight it with sophistication.
And we normalize this conversation.
And yes, it's a medical disorder.
And there is good news.
Okay.
We're now wearing ribbons, and if there's a 5K, I'm sure everyone in this room would run in it.
Yeah.
Yeah.
All right. Jane Pauley, thank you very much for being here. We have a list of mental health resources and guides available on our website, cbsthismorning.com/mental health. And remember, if you or someone you know is ever experiencing a crisis, you can call 911.